freshly picked fruits and vegetables, healthy products for your well-being, high-quality meat cuts, and a warm and friendly service. Low-cost supermarket, Sun and Main Road, Cunupia.
A meeting of friends, a familiar place, the first sip of something special, a moment of connection, a journey into nature, the sound of flowing water, the warmth of the sun, laughter, friendship, and a taste as bright as the moment. A bond between father and son, lessons passed down, memories created. The cool touch of the river, the crackle of a fresh drink. Moments like these are what stay with us forever. A sip of serenity, refreshing and pure, the gentle rustle of leaves. A push beyond limits, strength in motion, every step, every heartbeat, every challenge met with unstoppable power inside. The fuel to go further, to push harder, to be more. The grind, the focus, and at the end of the day, we come together. A table full of flavors, a room filled with laughter, a night of stories and memories. Different tastes, different moments, but one feeling. Because the best things in life aren't just tasted, they're shared. Taste Sultan drinks now. You know what you drink.
The Baraka December Expo is back. Come on down to the Baraka grounds in central Trinidad from Friday the 19th of December to Wednesday the 24th of December. Get ready to shop and explore a wide range of wonderful vendors offering unique gift items at affordable prices with the widest variety of choices. So remember the dates, Friday the 19th of December to Wednesday the 24th of December. 6 days of fantastic shopping at the Baraka Grounds in central Trinidad. It's the Baraka Grounds December Expo. Don't miss it.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to IBN's 20th anniversary, Doctor in the House. I am your host, Dr. Nadia Brafet Swamad from Health Express Doctors Limited. I graduated as a doctor in 2015 at the University of the West Indies in Trinidad and Tobago. So I have been a doctor for 10 years, alhamdulillah. I worked for a number of years in the accident and emergency department, and in 2022, I did my postgraduate diploma in family medicine. So today we will be talking on the topic of preventative medicine using hypertension or high blood pressure as an example. I have with me in studio my wonderful sister, Miriam Brafet Ali Isa, who is also a registered nurse, and she practices in the United States of America. Welcome, Miriam. Assalamu alaikum.
Welcome, salam. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Miriam Brafet Ali Isa. As my sister said, I'm a registered nurse. I practice in the USA, and I've been in different departments of medicine. First of all, I would like to thank one of our advertisers, Sultan Drinks. They have 4 products in front of us here, lemon, power, iced tea, and cola. And the beautiful thing is they all have black seed. So thank you, Sultan Products, for sponsoring and helping us. Okay.
Okay, great.
So, Dr. Nadia,
Yes.
you were here a couple weeks ago speaking about preventative medicine. Would you like to continue with us?
Yes. So I would like to share a bit of my experience when I was working in the accident and emergency department. So I just want to express how much I loved my job. I really liked seeing patients and taking care of patients. I looked forward to going to work, you know, when I get up to get ready to go to work for the shift, you know, I really enjoyed it. I loved seeing the patients. However, there was one thing that I kept seeing happening over and over, is that patients would oftentimes come into the accident and emergency department very ill. And a lot of times it's not because of an illness that wasn't preventable. A lot of times it's something that could be preventable. And I mentioned this in the last program that I would have done as well. I really felt in my heart, and I still feel it now, that if patients understood what is happening to them, how serious it is, that they could actually prevent themselves reaching serious complicated stages, you know. So because of this, I also always felt in my heart, I wish I can get out there and talk to patients and try to explain to them the nature of some of the illnesses and how we can prevent it from reaching to serious complicated levels or stages.
Right, so for me as a nurse, one of the first things, the patients, we are the first ones interacting with the patients. And we do see patients coming in with conditions that, you know, they let exacerbate to where now they're in pain. And many patients, when they come to the ER or for the accident and emergency department, it's because they're in pain. Most of them are in pain and afraid for their life. So with some of these techniques that you're introducing here, or telling these people and teaching our patients, they would be able to manage these conditions better and have more control over their lives and things like that. Continue.
Yes, so that is actually the aim of today's program. We're going to talk about high blood pressure or hypertension, or sometimes patients will say pressure, just refer to it as pressure, and that's fine too as well. All right, so today we're going to use the example of high blood pressure or hypertension or pressure, just simple pressure.
So what exactly is hypertension or high blood pressure or pressure?
Okay, great. So what is high blood pressure? Very good question. So sometimes you go to the doctor's office and the doctor tell you, well, your pressure high today, you know, what does it really mean? So I like to use the example of a hose. Think of a hose running from a tap. Okay, so you have water turned on in this tap and it's running through this hose. So that is the example similar to our arteries. So we have our heart, which is pumping blood, and it's flowing through the arteries. And the purpose of this is that the blood have to flow through the arteries to reach the different parts of our bodies, so it can bring nutrients and it can bring oxygen to the different parts of our bodies. Okay, so let's go back to the example of a hose running from a pipe or a tap. In this hose, if we turn on the pressure very high at the tap, the water is going to flow through the hose at a very high pressure. And what is going to happen to that hose over a period of time? It will start damaging the walls inside the hose. And what can happen is that damage repeatedly over years could actually burst the hose. You could actually have a tear or a burst in the hose. Okay? So similarly, in our arteries, when blood is flowing from the heart through the arteries to go to different parts of our bodies at a high pressure for a number of years, it causes damage in these arteries. And similarly, it could actually have a bleed or damage the artery so much so that it's bleeding out. So if the blood is not flowing where it's supposed to go and is actually bleeding outwards, okay, that part where the blood was supposed to flow that is not receiving nutrients and oxygen could actually start dying. So if that happens in someone's brain, all right, the blood is flowing outward, it's not flowing along the pathway it's supposed to flow to reach to the parts of the brain, that is actually called a stroke, because those parts of the brain that's supposed to be receiving oxygen and nutrients from the blood is not. So that part of the brain starts dying. right? And the blood is flowing outwards. So a simple example of what high blood pressure is basically that the blood is flowing through our arteries at a high force, and it's damaging the arteries on the inside. And this leads to long-term complications.
Right. So sometimes you have patients come in and they will tell you, I don't have high blood pressure. I'm just stressed.
Yes.
I'm coming to the doctor. That's what's happening here. It's not high blood pressure. I don't have any symptoms.
Yes.
Tell me about that.
So oftentimes patients would say, Doc, I'm not suffering with pressure, or I don't have high blood pressure. Doctor put me on some medication some years ago, but I don't suffer with high blood pressure, you know. So we can take a moment and just discuss this, okay? That's very good that you don't suffer with high blood pressure now. So the doctor put you on medication so that you wouldn't suffer with high blood pressure in the future, okay? So high blood pressure is often called a silent killer. Why? Because you don't feel anything happening until something very bad happens. Okay, so that's why you feel like you don't feel anything, which is good. We're very happy that you don't feel anything at this point in time. But if it is left like this over a number of years, okay, so this blood flowing at a high force inside the arteries could damage it inside. And what sometimes happens, let's say you get a cut in your hand, right? It will actually heal. And you get a cut again and it heals. But you know what? Over a period of time, it could form scar tissue. So in these arteries, when it is you have damage happening repeatedly, right, it could form scar tissue. You could have clots forming, and it could actually form a blockage in the artery. And the whole thing where, just like how if the artery get damaged and it bursts and the blood is flowing out, at this time, let's say you have a blockage, all right, or a clot forming. It could block the blood or prevent the blood from flowing where it's supposed to go. And again, the same complication happens where that part of the body could start dying, all right? So like if it happens, let's say for instance in the eyes, a patient with high blood pressure could actually become blind because the blood is not flowing as it's supposed to the eyes because of the complication of high blood pressure.
Okay, so in these situations, doctor, what happens now when a patient comes to you and you see, okay, they have this one high blood pressure at this time? Do you tell them to monitor their blood pressure? How are they doing this? How are we diagnosing hypertension or high blood pressure for this patient?
Okay. So we will talk about diagnosis. So first of all, how do you find out you have high blood pressure if you don't feel anything? Because it's considered a silent killer. So number one, you check yourself or you monitor for it. All right, if you have a blood pressure machine at home, you know, you can check yourself, check your own blood pressure, write it down, okay? Write it down on a paper, and when next you go to the doctor, or you could even check up online, what is the numbers that is normal? So I'll tell you the number at this point in time. Less than 120 over 80, so you usually see two numbers, a number on top and a number below. Now if you have a blood pressure machine, you'll see three numbers, one on top, one in the middle, and one below. So the one on top is called the systolic, and the one below is called the diastolic, and the one in the middle is the diastolic, and the last one is usually the pulse. Okay, you don't have to stress about these terms. You just write down the three numbers. The doctor, when you go to the office, will understand the numbers, right? Now, if you're seeing a number that is more, the first number is more than 120, the middle number is more than 80, and even the last number, which is the pulse, so normal pulse, let's say you see, you just write it down, all right? But if you're seeing it over 100, that is a bit of concern as well. Right, but you write these three numbers down, and once it's more than 120 over 80, you know that we getting into ranges that could be a little bit high. So you could notice that every day you write it down for like 2 weeks, okay? And then go to the doctor or go to the health center and present these numbers to them and let them see it and review it with you.
Okay, and do we want it just once a day, twice a day, 3 times per day? How do you advise your patients?
So you can do it one time for the day, that's fine. The fact that you're even doing it at all, we're very happy with that.
We are.
We're really happy.
We really are.
The correct way to do it, however, is that the best way to do it is to actually do it multiple times in one setting and write it down. But I don't want to make it seem like it's too much, so 1 time a day at least, and for at least 1 to 2 weeks, and you could take it in. That is a lot of figures that the doctor could still use to estimate, to have an idea what is your average blood pressure usually like.
Okay. So in this situation, a patient comes to you, they give you these numbers, right? What are your next steps? Would you say, let's try medication? How do you do this?
Yeah. So it depends on what the numbers are. Are they normal, controlled numbers? Is fine. That's good, alhamdulillah, if you have regular, normal numbers. However, is it elevated like in pre-hypertension? So pre-hypertension is just before you reach the level of high blood pressure, or is it actually the level of high blood pressure? So usually the first thing we want to advise patients to do is to do lifestyle changes. All right, so lifestyle changes include a couple things. Number one, most important, is decrease your salt. Decrease the salt intake as much as you could, okay? So I would often tell my patients, if a guy comes to the office, I would say, who is the boss of your home? Is it you or your wife? So if he say, well, it's the wife, then I'll say, well, go and tell your wife that Dr. Nadia Braffett says,
cook with less
you
salt.
need to have less salt, so cook with less salt. Okay, so yes, so we need to decrease salt, then we need to do 30 minutes exercise at least 5 times a day of the week, right? So when I'm speaking about this, I usually would tell my patient, try to do something that you could see yourself doing for the rest of your life. Okay, so in other words, like you mightn't be able, let's say for instance, you might want to join a gym. Good, but you might find that you're not able to keep up doing that for the rest of your life. All right, you might want to run around the savannah, and you might start with a lot of enthusiasm and motivation and so on, but you might find that because of your work schedule, if it's raining, you may not be able to keep up with that. So whatever it is you choose to do, try to do something that you could see yourself doing for the rest of your life. So decreasing the salt, exercising 30 minutes a day for 5 times a week are good. And also, if your doctor put you on medication, be compliant with the medication. Use the medications as you should.
Yes. Some of us don't like taking medications, and we don't want to take it for the rest of our lives. Tell me about that. When we meet those patients, the non-compliant patients, who are like, I don't like medication. I don't want to take it every day. Why I have to take this every single day? I'm not even sick. I don't feel sick. You know, what do you have to say to those patients?
Right. Again, very, very, very valid concern. So you don't feel sick. So you wonder, why do I need to take this medication? I don't like taking any medication. So I've never really met a patient who likes to take medication. All right. So yes, so most of the patients will feel a little bit, you know, it's a bit hard to take the medications because you don't necessarily like to take it. So I like to use the example of a vehicle, okay? So it's like you have a car and we have to maintain the vehicle, all right? So you mightn't like to go and change the oil when you need to change it. You may not like to do the maintenance of the vehicle, keep cleaning the vehicle, doing certain things, but it's still important for the maintenance and the good functioning of the vehicle. So even though a patient may not like taking the medication, that is totally understandable, you know, but at the same time, I'm very certain the patient definitely would not like the complications that can happen if we are non-compliant with our medication or if we don't control the condition. So the thing is, sometimes the patient don't understand how sick they can get, right? So high blood pressure could cause a stroke. A stroke could be very life-changing in a really difficult way for a patient, you know. So something simple as high blood pressure where you're not feeling any symptoms, you're feeling really good, you feel like you're not suffering with high blood pressure, which is true, you're not suffering at that time, but it could lead to a stroke.
Right, and that leads to a drastic decrease in quality of life, because when you're bedridden, you can't lift your hands, you can't do things, you can't turn your head. It's very hard. And then your family members, you know, if you are the breadwinner, it puts them on the breadline. It's much more difficult, you know. So I guess what we basically saying is prevention is better than cure. If we prevent it from happening, we don't have to try to cure it. And with chronic conditions, we know there are usually no cure. It's just managing it to maintain a good quality of life.
Correct.
Right? What about the patients who say, I don't want to get addicted to this medication. I don't want to be an addict.
Right.
What are you saying to them?
So again, similarly, we do hear this often that patients would say, Doc, I know I have high blood pressure, but I do not want to become addicted to medication. So first of all, let me congratulate these patients of thinking that they don't want to be addicted to anything. That is a very, very good thought process. We like that very much. So it means that this patient will tend to try to stay away from things that they think will be addicting. So congratulations on that thought. That is a wonderful thought. However, these medications are not addicting. So these medications are similar to the vehicle that needs to be maintained, all right? So you change filters, you change oil, you do these things to maintain the vehicle. Just like this, the medications is to maintain the health of the body and let's use again high blood pressure, to prevent the blood pressure from flowing at a forceful way that could cause damage to the arteries. So you don't get addicted. So let's say someone takes medication and for some reason they stop, let's say for instance, if they get the medication at home and they went and they were traveling, they would not suffer side effects from not taking it, like, you know, someone who's on substance abuse, like alcohol and so on, they may have some withdrawal symptoms. So a patient like this may have sweating and cold sweating and chest pain and dizziness and, you know, tremors and so on. So if somebody is on medication for high blood pressure and they stop using it, they would not have withdrawal symptoms like somebody who is addicted to something. Okay, so it's not addicting per se, but it is something that needs to be used long term to maintain your condition and prevent it from getting worse.
Yes, some medications do have side effects, and some patients do end up being allergic to some medications, right? So when you do the comparison now with side effects and withdrawals, okay, just to reiterate for our patients, with side effects, sometimes you might feel a little dizzy, a little nausea, you know, you might feel lightheaded. Withdrawals, you actually want to throw up, you feel like you can't live. You know, you feel so bad, you need to get this next fix. And that is not the case with medications for chronic conditions, right?
Yes, that is correct.
So can you tell our patients what they can do when they start feeling dizzy or weak, or they just nauseous from the medication? What do they do? Do we just stop it? Because some of them stop the medicine.
Yes.
Some of them stop it and say, I don't take that anymore, it makes me sick.
Yeah.
Tell them, please, help them, doctor. They need the help.
Okay, yes. So when we introduce a new medication to a patient, this patient can have side effects, okay? And side effects could be, so let's just say, for example, someone accustomed having a very high blood pressure, and we now introduce medication to them, to their system, that bring down the high blood pressure. So from functioning at a very high blood pressure for many years, we now bring down this pressure a bit. You can feel, definitely you would feel sometimes, you'll feel lightheaded. I once heard of a patient who said he was just feeling this coolness in his brain, you know, and for him that was a bit unnerving, you know. So yes, you could have symptoms because we bring in you from a condition where you were for many years and getting you into a more controlled range. So you may even, besides that, the medication itself could cause you to feel nauseous, could cause you to have some soft stools. It can cause you to feel lightheaded, different symptoms, all right? So the doctor usually would advise the patients for the first few days, you may be having some symptoms, some side effects, you know, so just bear patience with it, and after a couple of days, as your body starts to adjust to it, you know, you might find that the symptoms get less and could even fully, most of the time, they will fully go away. All right. However, if the symptoms is too much, let's say you find, you know, I always vomiting or always nauseous with this tablet since I started taking it, and I really can't go on, and you say, okay, the next thing to do is to go back to the doctor and communicate this. Tell the doctor, you know, this medication is causing me to have these symptoms and I'm not able to cope with it. you know, and the doctor actually, a lot of these medications have different brands. So sometimes a different company might use a different method in how to produce the same medication, and you might have less side effects with it. Okay, so you just go back to the doctor and say, you know, this medication causing me a lot of side effects, I'm not able to cope with it, and the doctor could actually adjust the medication. Sometimes it could be that you're using the medication wrong, or you're taking too much, or you're overdosing. So you just go back to the doctor. Don't just say, you know what, I tried it, it's making me sick, and I'm done, you know, because your condition is still there. All right, so go back to the doctor and explain to the doctor what is happening, and the doctor can help you figure it out going forward.
Right, and you can also decrease the dosage, right, with some of the medication. If it's too high for the patient as they now start, and you could decrease it to help them. So then we have these patients that say, I don't want to take up the doctor time, right? The doctor don't have time to answer my questions. You know, what do you tell these patients?
Okay, so on the topic of decreasing the dosage, please don't decrease your dosage for yourself. Let your doctor do that, because the doctor will be able to make calculations and so on and adjust it accordingly, specifically for you. All right? So concerning the patients who say,
we don't want to take up the doctor's time, we don't want to waste your time, doc.
Yeah. So actually, your health, the doctors are here to help you feel better and help take care of your health, okay? I prefer that you take up the time now, when we could help prevent a major condition later down the line, okay? So it's never too much to go back to the doctor, even if you're concerned. Let's just say finances might be a concern. So you may have seen a doctor privately, and then you're concerned, well, you know, I now have to go and pay a second visit fee, and I don't have that fee. You can go to the health center. You could go to the health center and say, doc, look, this is the medication that was prescribed for me, and I'm having symptoms. Could you adjust it for me? So that's one of the things you can do. All right? Or still go back to the doctor. I'm sure the doctor can adjust the medications or help you cope somehow. So one of the things the doctor might actually advise is sometimes to have a meal first and then take the medication, so that you may have less feelings of nausea. All right, so definitely don't just stop and give up. You know, definitely see a healthcare provider, and you can go back to the doctor. One more thing I just want to mention. So there is a difference between side effects and allergic reactions.
Yes.
So allergic reactions are specifically like if a patient's having itching of the skin, swelling of the skin, you might have swelling of the lips, swelling of the tongue, having any trouble to breathe when you take these medications. This is an allergic reaction. This is an emergency, and this you need immediate medical attention for. So you go to the accident and emergency department, or you contact back your doctor or the clinic, and they will treat you for an allergic reaction if this happens. So definitely a medication that causes you to have allergic reaction, you want to stop that medication and seek immediate medical attention for.
Right. So some of the allergic reactions as well can be hives. You just start breaking out all of a sudden, or your mouth starts scratching, as you mentioned previously. You do want to contact your doctor for that, you know. I mean, well, some people may have medication there, right? Make sure, please take your medication with you to the doctor, to the ER, so they know exactly what is causing a reaction, because you don't want to say, I'm taking this tablet, and in an emergency, most people do not remember what is the dosage and what medication they are taking. So please remember, take your medication with you and make a note. So whenever you go to another provider, you can let them know, hey, I am allergic to this medication. Okay, so that way they're not giving it to you again. So always make a note of your allergies and what your reactions are. Okay?
Yes. So on that point, I just want to mention, so sometimes a patient might come in and say, doc, I took a pink tablet or a white tablet. It's a little yellow one. All right?
Yes.
And what I want to explain to you, so is like different companies can make the same drug and present it in different ways. All right, so sometimes one company, it might look like a white circle pill. Another company, it might look oblong. And all of these are the same medication. So by explaining to the doctor, doc is a little pink tablet, or it's a white pill, the doctor wouldn't be able to say for sure exactly which medication it is. And thank God, alhamdulillah, we're in a time of technology. You know, sometimes it is when a patient comes and they don't have the medication, we might ask them, so do you have a relative at home? Ask them to take a picture and send it to us. Or you yourself can take a picture, and when you're going to see the doctor, the doctor would be able to see the medication. Or better yet, best if you bring it, because the doctor now can go through, look at the different labels, read the labels, you know, and see exactly which medication and what strengths they were. All right?
Okay, so we do have people who like using natural remedies. Okay, natural is good too, but sometimes we have complications. Can you explain that to some of our patients?
Yes. Okay, so let's talk about natural or homeopathic remedies. So first of all, let's understand that before medicine became this advanced, a lot of the things, a lot of the components in medicine now came from herbs. So let's give honor where honor is due.
Absolutely.
All right? Now, addressing the topic now, as doctors, we are only allowed to practice what we call evidence-based medicine. So evidence-based medicine is basically, let's say for instance, they take a medication or a compound or a drug and they test it, and they test it over a period of time, over a number of people, and they understand the side effect profile and the benefits of it, you know. And doctors now, are, because we are registered professionals, we are only allowed to practice evidence-based medicine, not because a friend or a neighbor or somebody say this is what works, okay? So again, respect to homeopathic medications and so on, but some of these medications, some of these herbs and so on could actually cause your liver enzymes to be elevated. It could actually be causing some sort of harm to the body. So just as medications, herbs could be good and have a lot of benefits in it, then you also have some that could have negative effects as well. So if you're taking any supplements or medications like that, you can go to the doctor and say, Doc, look, this is what I'm taking, or this is what I'm interested in using, and the doctor could advise you going forward. Now, do not ever switch out your normal natural medications that the doctor would have prescribed for you in order to use other medications, all right? Because remember, again, if we're talking about supplements, generally speaking, all right, supplements could be like, somebody might advise generally it's good, let's just say it's good for high blood pressure, or they might say it's good for diabetes, it's a good diabetes support, or it's a good support for people with high cholesterol. But the person or whoever recommends it don't know exactly what is your blood pressure level, or they don't know what is your cholesterol level. So let's say somebody have a cholesterol level of over 400 or over 300. Okay, taking a supplement is not treating the condition for that patient. Okay, so you want individual care for your particular health condition.
Okay, so with some medication, can medication and some natural remedies help? Can they work together synergistically instead of fighting against each other?
Okay, so we will address this when we come back from our break. And to our audience, Assalamu alaikum wa rahmatullahi wa barakatuh. We will be back shortly after a break.
At Extra Foods, we care for you. That's why we always have the widest variety, the best prices, spacious aisles of total convenience, plus clean, safe surroundings. Let us care for you. Extra Foods, always extra for less.
lunchtime. Fruitopia, Fruitopia, it's a drink that's hype. The citrus punch, fruit punch tastes nice. Guava, pineapple, that give me a vibe. We no want nothing less compared to the rest. Fruitopia the best. Punch any thirst when it comes to the test. Perfect thing for my lunch. Flavors pack a punch. Fruitopia, Fruitopia, it's a drink that's hype. The citrus punch, fruit punch tastes nice. Fruitopia, the drink that rocks your lunchtime.
Try our new passion fruit flavor today. Taste the passion.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Doctor in the House. I am Dr. Nadia Brafit Swamad. Alright, so I also have in studio with me my sister, Miriam Brafit Ali Isa, who is a registered nurse. Welcome back, Miriam.
Thank you.
Okay, so she had asked a question about using herbs and medication. And just to finish, my answer to that question is that any medication or supplement that you're using outside what the doctor have prescribed for you, definitely discuss it with your doctor. So a quick explanation is, let's say for instance, the medication is being processed through the liver, okay? And then you also use herbs or other supplements or other medications that could be processed through the liver. Overall, so many medications, you know, could actually over a period of time, could even cause some damage to the liver, and you can have like elevated liver enzymes and so on, right? So definitely any medications or supplements that you're using, discuss it with your healthcare provider, with your doctor, so that they can advise you going forward how, if any adjustments need to be made.
Yes, I mean, when patients come in, what we do, we take a list of their medications. Some of them forget to say, hey, I'm taking vitamin E, or I'm taking vitamin this, or whatever the case. And then their medication, their blood pressure medication that is supposed to lower their blood pressure, and they're taking something else that's thinning their blood, we find sometimes it can cause anemia, right? So some patients, we have that condition, so please, it's very important that you all let your providers know whatever you're taking over the counter. Even if you're boiling bush, let us know what you're drinking. Please let us know that. Okay, it could cause major complications, all right? So, I'm young. High blood pressure is only for old people. Tell me about that. When we find these patients telling us that, I young,
Yeah.
I'm not old, I'd rather go to the doctor right now. I only get a little chest pain now and then.
Okay. So yes, so this thought that we are young and illness only happen to people who are older than us, or people who are middle age or senior citizens, actually is incorrect, because of most of the time it's because of our lifestyle. So a lot of us live a bit of a sedentary lifestyle, you know, and when we work in, you know, we have high-paced jobs, we're in a high-paced environment, and a lot of times, sometimes most of the food could be bought, or also like a lot of fast foods, you know. So most of these have a high content of sodium or salts, all right, and this could cause our blood pressure to be high. I actually know of patients in their teenage years who went into kidney failure because of high blood pressure. And when you look at their diet, it usually consisted of a lot of fast foods, okay? So you want to always kind of keep a check on yourself. So let's say, for instance, you check your blood pressure and you find it's within normal range. You can do it at least once or twice or even 3 times for the year to just have an idea, to make sure that even though your blood pressure was normal before, that you're staying within normal range. So don't just think, well, because you're in your 20s or your 30s that you're just automatically healthy. You always want to keep a check on your numbers. What is your blood pressure? What is your sugar levels? What is your cholesterol levels as well? Because a lot of time we eat a lot of high calorie foods or deep fried foods or foods with a lot of sodium and salts in it.
Okay, so is this where we do like a yearly physical or something? Over here, you guys
Yeah.
do yearly physicals.
Yeah, so getting checked yearly. So sometimes you might go to the doctor and the doctor would want to check what is your sugar levels, or for the past 3 months, what was your sugar control. We call that a A1C. All right, so yes, you can go to the doctor and the doctor can do yearly checks for you. Sometimes, let's say for instance, a patient's number may not be indicating as yet that they, let's take the example of an A1C or somebody who we want to check what their sugar level is. All right, if it is elevated, it may not be elevated into diabetic range to say the patient is diabetic, but it could be elevated close enough or into pre-diabetic ranges. All right, so while we may not start this patient on medications, we may or may not, depending on what's the number, you still want to keep a check and monitor it to make sure that you go back within normal range or that you stay within normal range. All right, so yes, you want to get checked out by a doctor, and if let's say for instance we notice, the doctor may actually notice a trend. So let's say 1 year you do blood tests and everything is within normal range, and the next year you do blood tests. The doctor could use that first year that you did as a baseline. So let's say a year or two from that, we start to notice that this patient HbA1c is increasing. We will look back to see, well, what was it before and how quickly it's increasing. Or let's just say you find that the creatinine, which is concerning the functioning of the kidney, is starting to increase. So we could look back at the previous ones to see, well, what was the baseline. So sometimes you go to the doctor and you do blood tests and you find, well, everything come out normal. Alhamdulillah, that is very, very good if everything come back normal. But it's not a waste, because it could be used in future as a baseline to check back. And also to mention, also to monitor and see that you're staying within normal ranges as well.
Yes, we love having a baseline when you come to the doctor. We want to know what it was before. I love going back and checking everything so I know where I'm going off. So sometimes even you might have normal results and have different symptoms, right? So that do happen. Now tell me, doctor, can skinny, normal people who are not big like us have high blood pressure and high cholesterol too?
Yes, definitely. So someone who could be physically fit could indeed have high blood pressure, could have high cholesterol, and even could be diabetic as well. And you wouldn't know unless you do the tests, to check to see what your numbers are. All right, so yes, it could be sometimes you might have somebody who may be obese and don't have these conditions as well. So don't just use the physical structure or physique of someone to know, to think, well, are they within normal ranges? You actually have to check the blood pressure to know what is the blood pressure level. You actually have to check your cholesterol, because you could be fit physically and have a very high cholesterol as well. So you don't just take it for granted, still get checked out.
Yes. So diet, we were talking about the diet, we were talking about decreasing salt. Mm-hmm. Well, I will tell you this, right? I like my food with flavor. I need salt. I like salt. I like to taste it. Okay? But since I come to Trinidad, decreased salt and more seasoning. And we're not talking about the salt seasoning you buy, because that has more sodium. Tell me, doctor, how are we doing this when we have food with no salt? It's hard.
So for patients who like tasty food, yes, you can actually have fresh green seasoning to make your food more tasty. And also consider some of these foods actually have a natural salt in it. But over the period of time with us eating very high levels of pepper and salt and so on, we could damage the taste buds on our tongue. So you may find that you're not tasting the salt. So someone else may find, wow, the salt is too much. And another person might find it's not sufficient or it's not enough. All right? So just remember that when you're decreasing your salt, you can also consider to increase your natural green seasoning. So not the seasonings that have a lot of salt mixed in with them. All right, so you could think of other ways to make the food tasty for you, and green seasoning is a good way to go.
So we're talking about shadow benny and chive and garlic. Pung up your garlic real good and mix it in.
Yeah.
That's flavoring, and some pepper, pimento and things. That is very good too. So let's continue with diet. Talk to me about meat. Do we want to eat meat? No meat? Yes meat? How meat? I love meat. I eat meat. Go ahead.
So protein is a natural part of our diet, so we do not ever want to cut out a whole component of your diet. So yes, eating meat is fine. You know, you just have to, so I like to recommend patients to see specifically dietitians, because what a dietitian will do is that she will take into consideration your health, and she will also take into consideration things that you like. And now she could recommend, he or she, whoever the dietitian is, could now recommend or advise you how to eat that is a way that is satisfactory for you, would keep you full, and still taking into consideration your general health. So never just say, you know what, I'm going to just cut out all carbs from my life. Or I'm going to, because you still need energy to function. Or I'm just going to cut out all meats. All right, so definitely it's very important for us to consult with dietitians as well for our individual needs. I would really like to talk about stress and high blood pressure as well. What do you think about that?
Stress, high blood pressure. We live a very stressful life, right? And sometimes, as some people would say, I don't have high blood pressure. But the symptoms that's been shown to you, you come to us for help, right?
Yes.
So tell me, doctor, some people say, I get it from a family, all of you have high blood pressure. Is that true or fake?
Yes, so that's actually a thing. So genetics could play a role. Genetics in itself is a risk factor, and it could play a role in somebody having high blood pressure. Okay, it's your risk factors also increase with smoking. So if someone smokes, it increases their risk of getting high blood pressure. So much so that if we have a patient who smokes and they have high blood pressure, this is one of the things we recommend for them to do. Stop smoking, or at least decrease it until they eventually stop, to help control the high blood pressure as well. Okay, so talking about the high stress, so sometimes we tend to find patients who lead in a high role or in high positions, like for instance a manager. You know, in fact, you don't even need to be a manager. You could just be a mother, a caregiver to your home, because you're managing. Yes, you're managing so many different things at the home. You know, so in a normal job, but we notice that people who tend to be in a high stress job, they also tend to have high blood pressure as well. Okay, so sometimes these patients not able to just change what could be causing the stress, the job itself by nature, or the responsibilities the person might have may be high stress in itself. And if the blood pressure is high consistently, we still want to start medications to control that blood pressure to prevent complications later on in life. All right, so someone may be in a high stress job and you find you're relating that to the job itself. And also you want to see, is there any way that you could try to control or manage the stress, you know, things like relaxation techniques as well. So whatever could be your attribute to causing the high blood pressure, these are the things we want to address as well.
Right. So, I mean, when things become very hectic for you, sometimes it's just taking a couple minutes. Take a few deep breaths in and let it out slow. We call it pulse breathing. So you're like about 5 breaths, just to kind of ground yourself and get back to, you know, where you are. It helps to calm you down. So processed foods, canned foods, a lot of sodium. Now sometimes you would see on the can it say less fat. What happens, they decrease the fat but they increase the salt, right? So pay attention to that as well with the sodium and stuff in your foods. We already talked about decreasing salt. We talk about not smoking, cut it down little by little. Alcohol, you know, when people get a cold or something happening, they say, man, what is it? Drink some Henny or drink some
Scotch?
I don't know.
Bourbon?
White oak is white oak. I think it's white oak over here, right?
Yes,
Drink some white oak. That'll take away everything. Tell me about that. When they drink the white oak and the tablets and stuff, what are we doing with that? Because we do have people that do that.
Okay, so definitely do not use alcohol to take medications. Use water. Take your medications with water. Do not use alcohol to take medications. And yes, alcohol. So when we have patients with high blood pressure, we also advise them, especially if they drink alcohol to an excessive amount, we also advise them to decrease the level of alcohol. If we find someone in a situation, let's say for instance, they're addicted or they use or they consume too much alcohol, then we could try to help them to decrease it or even stop using it as a substance abuse to that level. Okay, so we try to get them help if they need help, because someone who is an alcoholic is actually considered, alcoholism is actually considered a mental health condition.
And it's a very dangerous condition, because withdrawals from alcohol can lead to seizures. It can lead to so many complications that if somebody is accustomed drinking a certain amount for all this time every single day, and they just stop like this, it can cause a lot of damage. So you want to speak with your healthcare provider to kind of help you to get over it, cut it down little by little, so you don't experience these withdrawals, because they can be really detrimental to your health. All right? So,
and just one thing on that note, so someone who is, let's say, addicted to alcohol or drinks a lot of alcohol and suddenly stops could have severe symptoms, and definitely you go to the hospital or you go to your doctor, and they can as well treat you and help you to cope with these symptoms.
Yes,
right?
they can help to make the symptoms manageable. It's not going to cure you, and it's a very hard condition to be in where you're addicted to alcohol. So get help for it when you actually decreasing and coming off of it. Now, even though it's hard, it don't mean you're not going to do it, right? You want to try to get off of the alcohol, but you want to do it in a safe manner, all right? So since we're talking about blood pressure, high blood pressure, and we learned don't drink alcohol with your medications, and if you're taking medications, decrease the alcohol. Is high blood pressure curable?
Right. So I have heard rare cases where people, when they commit to lifestyle changes, so for instance, if they were obese, they lost weight, they decreased the salt, they stopped smoking, they started doing 30 minutes exercise consistently. You have heard of cases where patients will control the high blood pressure, but you don't often hear that it is fully reversed in the sense that they fully come off medication. So sometimes when you have a condition and it starts to get controlled, the doctor may decrease the intensity of the medications so that, as you're getting better and better control, they might decrease the strength, they might half the dosage. Now, this is not something you want to do for yourself, right? The doctor will usually do that in accordance to how your numbers read. And sometimes it may be that you're within normal range, you're fully controlled, but you still need some of the medications to keep you there. Because remember, at one point in time, you even went there even without medications. So it's possible that even if your lifestyle changed so significantly and you're maintaining that very good, but do that in accordance with your doctor as well, so that they can help you stay in that controlled range. All right, so we are now at the end of our program, and we would like to thank all of our guests and listeners for paying attention and allowing us to be here today. I would like to thank IBN Television for having us, and also thank my wonderful sister Miriam Ali Isa, who is a registered nurse, for coming on this program with me. So
thank you.
Jazakallah for having us here today, and we wish you all of the best with your health. Feel free to ask questions. I always believe there is no question that is a bad question, especially when it comes to your health. All right?
And ask your doctor for sure, and your nurse. Get to them if you don't understand. If you do not understand, you cannot help yourself. So you need to know exactly what is causing you harm.
Yes. And again, thank you, and hope to see you on the other programs in Doctor in the House. Assalamu alaikum wa rahmatullahi wa barakatuh.